Welcome to Unstitching ADHD Urban Ed Talks, where we explore real stories, strategies, and systems that shape how we better understand and support neurodiverse learners, especially those with ADHD. I'm your host, Dr. Stanley Ekiyor, and today joining me is Dr. Karen Wilson, a clinical neuropsychologist, a professor, advocate for children and adolescents navigating ADHD and learning differences. Today's conversation focuses on how ADHD shows up in children and adolescents and what families, schools, and professionals can do to better meet their needs. Dr. Wilson, thank you for joining us and welcome to the show.
Dr. Ekiyor, thank you so much for having me. I'm thrilled to be here.
We are honored to have you. And what drew you into the focus on ADHD learning differences in kids and teens? Was it your personal experience or something you noticed in your professional career that led you to this important work?
What's interesting is that I started my work on the other end of the spectrum, working with older adults. When I was doing my training, I had to do a rotation in pediatrics. And once I started working with children and adolescents, I knew that I wanted to keep working in that area. I was drawn to the work because I kept meeting children who were bright and capable, and their struggles were just misunderstood by parents, misunderstood by teachers. Oftentimes they were labeled as lazy, they're thought to be defiant, when in reality their brains were working overtime to compensate for challenges that no one had identified.
Oh, interesting. Now, over the years, have you seen the understanding and diagnosis of ADHD change? For instance, are schools or clinicians getting better at recognizing the different presentations, especially amongst girls and students of color?
Yes, I think our understanding of ADHD has really become more sophisticated over time.
Mhm,
We know that it used to be viewed mostly as a behavioral problem.
mhm,
Young boys who couldn't stay in their seats, who were
mhm,
hyperactive, who couldn't sit still. Now we know it's a neurodevelopmental condition. It involves different brain networks that regulate attention, executive functioning,
mhm,
and emotional regulation. So it's more than just attention and hyperactivity. And like you were saying, we've learned also over time that ADHD presents differently across different individuals. And so you mentioned girls. Girls are often undiagnosed because they tend to be more inattentive rather than hyperactive and impulsive. And they internalize a lot of symptoms and don't appear disruptive. Oftentimes they get missed because their behaviors are not as obvious. We also know that children of color are more likely to be misdiagnosed or go undiagnosed. Some of that is related to implicit bias, but we're becoming better at recognizing that a lot of individuals tend to, with ADHD, will mask or
mhm,
compensate for their difficulties, which make them look like they're capable and they're doing what it is they're supposed to do, but they're doing
mhm,
it at an emotional and cognitive cost. And I think we're better
mhm.
at recognizing that as well.
That's great. Now let's talk about the myths and
Yes,
misconceptions.
there are a lot of them.
So, can you share with us some of those that you've heard people say and you're like, okay, let's start all over?
I think one of the things I often hear is that, I have parents, I meet with them and they might say, our pediatrician is thinking it's ADHD or the teacher's thinking it's ADHD, but I know that it can't be ADHD because they can play video games forever, right? They can
Mhm,
pay attention when they're interested in something. That is a myth, right? Because we know
mhm,
with ADHD, and the research tells us that individuals with ADHD, it's not that they can't pay attention, it's that they can't keep on paying attention when something is no longer interesting to them,
mhm,
which makes
mhm,
it very hard for people to understand. They can't pay attention when they're doing schoolwork, but when they're playing Roblox or Minecraft, they can pay attention, right? Engaging in those kinds of activities have different demands on the attention system, which is why it looks differently. And like I said, the research shows it's that the non-preferred tasks is what individuals with ADHD have a hard time persisting with. And so that is a myth that it could not be ADHD because they can pay attention in certain circumstances. The other thing is that ADHD is just about being hyper or distracted. And we know in reality, it's really about self regulation. It's the ability to manage and regulate your attention, emotions, impulses, and even your understanding of time. And so it goes far beyond just attention and hyperactivity and involves a number of other things. Another big one is that kids will outgrow it. Right. We know from longitudinal studies that 60 to 70% of children continue to experience symptoms all the way into adulthood, although it does look different. A lot of the hyperactivity and impulsivity will dissipate, but you might have more difficulties with executive functioning. Even some emotional regulation issues might persist. It's a lifelong disorder. It just looks different in adults than it does in children and adolescents.
That's good stuff. Most times people listen to TikTok and now they feel like they can diagnose ADHD. Everybody,
Right.
everybody knows who has ADHD. I think it's ADHD. People speculate a lot about that. So that brings me to assessment.
Yes.
How do neuropsychological assessments help guide better support for students?
I think one of the things that a neuropsych assessment does, it creates almost like a map of a child's brain in action. It doesn't just determine if a child has ADHD. That wouldn't be the purpose of most neuropsych assessments. But oftentimes, again, when people are coming for neuropsych assessments because they don't know what's happening. Is it ADHD? Is it a learning disorder? Is this a social emotional issue? Is this something else going on in terms of processing? They don't know. A neuropsych assessment helps identify the why and how behind learning social, emotional, or academic struggles. And so, in the context of that kind of assessment, it's an indirect look at the way the brain is functioning and tells us how the brain is wired. And so, we will look at general problem solving ability, attention, and executive functioning, which is the ability to plan and organize, manage your time, inhibit impulses, regulate your attention. We will look at working memory, the ability to hold things in your mind while you're doing other things. We'll look at short term memory, long term memory. We'll look at the ability to process information quickly. And we'll also look at language processing, visual spatial processing, and all those social emotional factors that can impact daily functioning. We'll look to see if there's anxiety, if there's depression, if there are self concept issues. We'll look at what teachers and parents are telling us about what's happening in the school and in the home environment. And what that does is it gives us a nice picture of a child's strengths. What are the things that they do very well and with ease? And then where are the areas where they seem to need more support? And sometimes that profile will reveal an ADHD. It may reveal something else that looks like ADHD, but it's actually not. And what that does is it tells us where to intervene. Because if it is ADHD, then we have a treatment plan for that. If it is anxiety, then there's a different treatment plan for that. And if it's a learning disorder, then there's a treatment plan for that. The neuropsych assessment helps us to identify why a child is struggling and helps us to determine the kinds of supports that are needed at home and school to help that child thrive.
Thank you for breaking this down. I have opportunities. Most times I do trainings, professional.
Yes.
I prefer to call it professional learning experiences because
Hmm.
it's not just one and it's done. And I tell people, when we talk about ADHD, it's not, if you see me with 2 cups of coffee and I'm jumping all over the place, it's coffee. It's not that I have ADHD. So getting to understand and knowing the root cause and
Yes.
what you have described is holistic.
Yes.
You have to look at everything, you have to rule out everything
Right.
so that you're not just chasing symptoms,
Right.
but you're going after the root cause and knowing the right strategies to use. So thank you so much for
Yes.
breaking that down
Right.
for
And
us.
I think another important thing that you mentioned is that,
Mm.
you talked about at the beginning that, you know, people are self-diagnosing ADHD. And I think one of the things when you have a good ADHD diagnosis, you're not only looking for symptoms, but you're looking at, are they occurring in two or more settings? It's not just at home, it's not just at school. And is it causing distress or impairment in their life? So it's not just that you can't pay attention, it's having a negative impact on a person's functioning. When it crosses that threshold, that's when it becomes ADHD and not just struggles with attention.
Thank you. I love this. Is it affecting in schools? We say,
Yes.
is it affecting the kids' ability to function in that
Yes.
environment to succeed.
Yes.
It's not just compliance to suit or,
Hmm.
make us comfortable, the adults. Our jobs are not supposed to be comfortable, I'm sorry to say,
No, they're not.
you know. So, so this leads me to our next question.
Mhm.
For a parent or a teacher listening right now, what are the early signs that they should begin to ask questions? They should begin to say, hey, let's check this out, what's going on with my child. Are there subtle indicators or that often we overlook beyond inattention or hyperactivity?
That's such a great question. And I think again, ADHD is it's like a spectrum, right? And there we know that there are three different presentations of ADHD, so it's going to look different in different people. Even in terms of age groups, in preschool and elementary school years, some red flags might include, intense emotional dysregulation, right? Tantrums, frustrations, low frustration tolerance can indicate poor emotional regulation, which is a symptom of ADHD. It can look like different difficulty following instructions and directions, particularly multi-step directions when you're looking at elementary school. Excessive movement, fidgeting, impulsivity, so kids who can't sit still. We're always looking at them relative to their peers, right? If you're looking at preschool and elementary years, we are looking at them relative to their same age peers. Are they having more difficulty than other 6-year-olds sitting still, listening to stories in the classroom, following along while someone is reading them a story before bedtime? We're looking for that excessive movement, which can be a red flag. Difficulty focusing during play or in group activities can be indication. Once we move into later elementary and middle school, you might still see some of that inattention, fidgetiness, and restlessness if it hasn't been identified when kids are younger. But then it starts to look like chronic disorganization. So those are red flags. Kids who are very bright, might be participating in the classroom, the first to raise their hand, have thoughtful responses, and engage in discussions, but they're always forgetting their water bottles and their jackets at school. They do their homework, but leave it on the printer. They did the assignment, but forget to turn it in. Issues that look like chronic disorganization can be a red flag. Also, inconsistent performance, doing well one day but struggling the next. That has to do with regulating attention and focus. Oftentimes, if you think about executive functioning, another red flag would be trouble getting started on tasks or completing tasks. Kids will look at a blank page for a long period of time but can't figure out how to start that essay, how to start that project. And then you have procrastination, right? Things get turned in late or not at all, or they start tasks but they don't finish them, they forget to turn in completed work. So those can be some indications of ADHD. Socially, it can look like a young person who's interrupting frequently, blurting things out, or other kids will say they're too much. They're just a lot. They have a hard time recognizing personal space. They're always in kids' faces and very excited. That can create social challenges for some kids. At home, parents might see a lot of homework battles with getting started on tasks, completing tasks, having meltdowns during transitioning from video games to schoolwork or from schoolwork to bedtime. All of those things can be red flags that ADHD might be present, or at least it would warrant some follow up discussions with teachers, a pediatrician, or an assessment to determine the root cause.
Good. You see one kid with ADHD, you have seen one
One kid.
kid or adult with ADHD,
Yes,
right?
yes.
So not two are the same. I like that. Thank you. How often do you see ADHD overlapping with mental health challenges in young people?
I see it quite a bit, and I think the research shows that up to 60% of children and teens with ADHD meet criteria for another disorder. Most often it's anxiety disorders or depression. There are a number of reasons why that intersection happens. We know that the same brain networks, particularly the prefrontal cortex and the limbic system, are involved in both emotions and cognitive regulation. So it's not unusual to have mental health and learning challenges connected. They're connected in the brain, so you're going to see them behaviorally, and it's going to show up at home and at school as well. We also know that when kids with ADHD struggle academically or struggle socially, it can really erode their self esteem, and that can lead to internalized distress, which can contribute to anxiety and depression. And also, the repeated negative feedback that some kids are getting, particularly when the ADHD is not diagnosed or hasn't been identified. They get messages from teachers, parents, caregivers that they should be trying harder. They're just being lazy. Why are you being so careless? And that can increase stress and anxiety as well. We do see the overlap with learning and mental health challenges. And it's often important to identify that both are present, because if you have an individual with ADHD and anxiety and you're only treating the ADHD, it may alleviate some of the anxiety, but if it's really co-occurring, you want to be able to recognize that both are present so that you can treat both.
Thank you. Most professionals use the word comorbid
Yes,
condition, co-occurring
yes,
condition. It just means that they have more than one, of those. So thank you
that's
for
exactly it.
breaking that down. Let's look at school-based strategies,
Hmm.
right? I was looking through your work. You've really been involved in so many great works. Are these strategies, which have you seen that you can say, yes, the best support neurodiverse learners, especially those with ADHD? And of course, I always say, if it works for them, it works for everybody
It
in the
does.
classroom.
That is exactly it.
So, can you share a few practical approaches?
That is so true. And I
Mhm.
think the best interventions are those that are personalized for what the student needs, right? Because like you said, if you see one person with ADHD, you've met one person with ADHD. And two people with the same diagnosis can need very different things in terms of support at home and in the classroom. The best intervention is the one that meets the needs of that student. And when we look at what those needs typically can include, it's making sure that the environment supports the child's learning profile. So, making sure the accommodations and the modifications are put in place so that a child who takes longer to complete assignments isn't being penalized for not completing on time. So, having that extended time, making sure they're not sitting in the back of the classroom near an open window and another chatty kid. A kid who's get easily distracted, that's not the best place for them. So having that preferential seating can make a big difference for those kids. We know that individuals with ADHD are more easily distracted. They have a hard time tolerating boredom. They pay better attention when they're interested in the subject matter. So matching teaching strategies to the interests of the learners is really important. Does everybody have to write a paragraph on a particular topic, or can they choose something that aligns with their interests? I think matching teaching strategies to a child's interests is important, and also making sure that you're teaching to their strengths. Using visuals for individuals who have a strong visual system, doing a lot of verbal repetition for individuals who have struggled with auditory processing in addition to their ADHD. And multisensory techniques are often very important to keep individuals engaged who are more likely to zone out in lessons. Hands-on activities where kids can be actively involved can be very beneficial for students with ADHD. The other thing that's been really helpful, particularly when you think about middle school to high school, is providing support for executive functioning. Executive functioning, again, is kind of an umbrella term for things like planning, organization, time management, prioritizing, task initiation, shifting your focus from one thing to another. And individuals with ADHD struggle a great deal with executive functioning. So, working with an executive functioning specialist, an educational therapist who specializes in executive functioning, can help individuals learn better time management, better organization strategies, learn how to better plan, because a lot of times the assumption is that these will develop naturally, but for individuals with ADHD there can be a delay in the development of those skills, and they need more support in learning that. So we know that support can be very helpful in the classroom. Movement breaks for individuals who have lots of energy and need to move around, and often moving around helps them to learn. Incorporating physical breaks and flexible seating to support regulation and attention can be helpful. I think a piece that often gets missed because we're often so busy trying to provide the accommodations and the modifications and the private room for testing and, you know, noise cancellation headphones is that students learn best when they feel emotionally safe. So, making sure in the classroom that that student with ADHD or another form of neurodivergence has a trusted relationship with an educator, a counselor, a mentor, it's critical. That positive student teacher interaction can lower stress and improve focus. So, I think that we have to remember that empathy driven support is very important to be incorporated into any treatment plan for a student.
Now, to parents
Mm,
listening, especially in communities of color where
mhm,
some people still equate
mm,
the characteristics to behavioral challenges that they need
right.
to take care of, right? What will be one takeaway you would like parents to reflect based on your experience and your work that can help us begin to shift,
Yes.
the conversation from thinking a kid is being defiant
Mhm,
to understanding that this kid truly had challenges that they cannot deal with. Like I say, I use this example all the time. It's like telling a kid with ADHD to sit still,
mhm,
for 45 minutes listening to you is I equate it to telling somebody who has allergies not to sneeze.
mhm.
It's never going to happen.
Right.
So that's why we provide certain strategies for those who have allergy to either sneeze into your hands in the classroom or close your mouth. And if it's serious, we think about other interventions. So, what will be one takeaway based on your experience that you can share
Yeah.
with parents to help them begin to embrace the reality?
I would say to get curious. We often, want to stop the behavior, we want to punish the behavior, but if we try to understand why that behavior is happening to begin with, then that will lead to better understanding for everyone. And once we understand that the behavior is because of the way a child's brain is wired, then we don't blame them. Oftentimes we blame the child or ourselves for poor parenting. When we can understand, we can become more patient, we can advocate for what our children need and support them by focusing on their strengths, their unique talents, the things that they do well. We can build the routines that they need in order to get the support that they need, and we can collaborate with teachers and other professionals to ensure that our kids can thrive. And so that is what I would say. Get curious, seek to understand why your child is behaving that way. And once you get that information, you can support your child appropriately. When we understand and we can support, then our kids can flourish.
Exactly. Why? The big question. When we ask why, our
Yes.
brains want to figure it out.
Hmm.
But if we say we know, then the brain starts looking for something else.
Right.
So the why is the big question. Why is it happening? Why? And you will get answers.
Yes.
I appreciate that. Now, on a final note,
Yes.
my introduction did not do justice to the work you do. I was trying to put things together, and I'm like, you know what? I will let us speak to our work. For those that are listening to you, the work you do,
Hmm.
how I know there are people who will write in the comment section, I need to talk to her, I need to see her.
Hmm.
How will they get in touch with you? How can they link with you?
Yes, I'm a clinical neuropsychologist, so I do evaluations of kids who struggle with learning, but I also do consultations with families located in California or Toronto, Canada. I'm licensed in both areas. My goal is to help parents and educators better understand why kids are struggling and give them a plan to support them. If you're looking to get in touch with me, you can go to westlaneuro.com, and there you can find my contact information, some information about me, and the services we provide.
Thank you, Dr. Wilson, for sharing your insights and experience with us today. Your perspective really helps bridge the gap between research, school practices, and family life. And to our listeners, thank you for tuning in to Unstitching ADHD Urban Ed Talks. Don't forget to subscribe, share, and most importantly, join this critical conversation online as we continue to unpack what it means to truly support neurodiverse learners in every community. Let's keep this conversation going one stitch at a time. Till next time, remember, behind the cloud is the sun. It will shine. It always does. Keep learning, keep growing, and keep the conversation going. Thank you very much for joining us today.
Thank you for having me.